Hey, everybody. Welcome to Dr. Tim. This is a really exciting show. We're on location, and we're going to be talking about Tim having major surgery tomorrow. And this episode's going to be a little hard for him. Tim doesn't like to talk about himself, so I'm going to help. I'm worried about my friend, and I'm excited for him to have this procedure, but we're going to really get into it and also talk a little bit about what's going on, what you might be worried about in the news right now with medical stuff. So I'm just very thankful for my friend Tim Peck, and we're really going to focus in on him, whether he likes it or not. And please join us. So let's do this. Okay, Tim, how's it going? You got anything big going on in your life?
Just a little something. Been doing so much over the last 2 or 3 weeks to clear my plate because I have to be away from pretty much everything for 2 weeks. A lot of things for 4 weeks, and I won't be recovered for at least 6 to 8 weeks completely. So
6 to 8 weeks. You're the busiest person I've ever met. To see the busiest person I've ever met try to do double or triple what he already does has been impressive and worrying.
Thank
I think.
You. Worrying.
You're
it's not only my
your
professional
wife has
life,
messaged me before, and I've said I'm thankful that you have her, and she has messaged she's thankful that you have me, because when you're away from her, I'm here. I'll care about you, and so I think I'm going to be messaging her starting tomorrow to find out how you're doing.
Well, and it's also how she's doing, right? A lot is going to fall on her. We have a 2-year-old at home, and I can't pick him up for at least a month.
I've had that happen. Yeah, that's hard.
And so we have a spreadsheet at home. It's called Babysitting Tim. And it's like filled in shifts for who's going to be there. If Cass is also there, because if he gets in trouble, if he runs away, I can't run after him. I can't pick him up. So like this is it's a big pause to life. And I should have really been having the surgery a while ago, but just could never find the time to do it. Yeah.
So I'm really glad you're taking the time. I'm glad it's tomorrow. I've always told you your health is number one. Friends first, health first. But Tim's been pretty quiet about this chronic, what do you call it? A chronic illness that you've had since what, your 20s?
Yeah. So, I have like IBS symptoms. A lot of people have that. A lot of people laugh at what that is. So, irritable bowel syndrome, calling it, right? Which means I just live with pain in my stomach at all times. So mostly in the left lower side of my abdomen, just it feels like glass is being crunched up. That's how I describe it. And I don't tell anyone. I've never even told you that.
No, I knew you were in pain, but I didn't know how bad it was.
I just learned to live with that. And a lot of people, it's a spectrum disease. So a lot of people have little symptoms. Some people have really bad symptoms. And then there's kind of an inflammatory bowel disease, which is when the intestines in different parts might be inflamed and bleed and causes tons of pain, nausea, vomiting, various bowel habits changing. And so I don't have that, but I also have some functional problems with my intestines. They don't work exactly right. So, and the muscles around them. So they're going to be in there. Removing things, tacking things down, stitching things, using Botox to relax some muscles in there.
Oh, wow.
Which is
that makes sense because it's too tight, so it's causing pain.
And so, all of this. And really the problem is the bleeding. And so I bleed a lot. And so the bleeding's gotten to a point where, I like to swim. I can't swim without about 12 hours later just bleeding so much because of all the pressure that
the water puts on you?
Not the water, from your abdomen tightening up. So like running I can't do, or do a lot of, like, at this point
and
I can't
you like
do anything.
To work out. Working out is the stress relief for you. So that's my biggest stress relief. So hearing that, I'm like, that's hard. That's
so at this
hard.
point I just can't do it. Like if I do, I have to deal with the consequences with bleeding, and then my blood levels get low, and then I get tired. So I haven't bled for I don't know. It's been a couple of weeks, which is great. Which is funny that it stopped right up
before the surgery. I'm getting to the point now where I can tell. I can look at you and tell, even if you don't tell me, if it's been a bad week or not. Yeah. So you look like you've had a good couple of weeks.
I've had a good couple,
which is good since you've been double busy.
Yeah. And then yesterday I started bleeding again. So
what time is the procedure tomorrow?
I have to be there at 5:30 in the morning, and supposedly it starts at 7:30.
When do you stop eating?
This afternoon. Yeah.
And Tim has been on a very strict diet for the last little over a month. You called it the beige diet?
Yeah, the sad beige diet.
Sad beige
diet.
Yeah, which hurt whenever we'd meet, I'd bring a snack for you, and you're like, yeah, I can't eat that one. You could eat a banana, but I'd always not have a banana. So that seems like it's been really fun.
One of our watchers has IBS
Tiffany.
too.
Hey, Tiffany.
Yeah.
Aww.
Yeah, and it's one of those diseases you don't talk about because it's embarrassing. And how do you fit that into a dinner conversation, right?
And when you're running for Congress, you want to appear strong and capable leader.
Right.
But the thing that I know about you is you're different than most people that run for office, and you're more compassionate and have more empathy. And a part of that is because you have a chronic painful condition, and it helps you empathize with people in pain.
Yeah.
So I think it's a superpower, but it's one I wish you didn't have.
Yeah.
Because you care so much about people. I think it makes you a good emergency room doctor. I think it makes you a good candidate, and it would make you a great congressperson. But I understand your fear to share it, because we are taught in our society that sharing your weaknesses is bad. Act perfect.
Yeah.
And I think that's the biggest thing people don't like about politicians is the fakiness.
My wife always says, when you're a politician, when you're running, you're supposed to have a family, right? You're supposed to have a wife and a kid. And,
you got this model.
Right. And on your literature, you have a picture of you and your family and all of that, but you're not actually allowed to have a family. You're supposed to have it, but then people don't expect you.
You're supposed to go to every event all day long and never see them.
Exactly.
And they're supposed to be lovingly waving in the background, so happy.
That's right.
That you have been taken away from them.
Right. And so, and
that's
when you start talking about it, it sounds like complaining, right?
Right. You don't want to
seem
complaining.
And now you're talking about yourself and your own needs, but it's more about other people's needs. But as you are pointing out, you really do need to take care of your own self and your own health to be able to take care of others. And this has gotten to the point where if I don't take care of myself, I'm not going to be able to do anything for anybody else.
So my job as your good friend, as a co-founder, it's just the two of us, is to make sure you put your health first, and then we do this second.
Yep.
And I hope we always focus as we grow Project Next and get more people, and we start paying for people and grow, that we keep that. Everybody needs to be mentally healthy. They need to put their families first, and then we focus on making people's lives better, growing, uniting community. Because if we don't have that, if you're too sick to get up and exercise, how are you going to meet tens of thousands of people?
Yeah.
So, so I'm...
And just a note, I'm not going to be on the show or any of these shows for at least 2 weeks. I'll be on pain medications for at least 2 weeks, probably more than that.
It might be fun to do a show of you laying in your bed. That'd be fun. We're like, are you relaxed? Let's talk about relaxing things. I think it might be fun, but only if you can tell it. You should see his list of things he's put to do while he's recovering from surgery. It's the busiest recovering from surgery list I've ever seen, which tracks. Yeah.
But it's also entertainment, right?
So,
yeah.
You put a few entertainment things, but you mostly put learning things to make yourself a better person.
Yeah. Baseball opening day is coming, so that's
I'm really
exciting.
glad
So
you're going to have time to watch baseball.
And I printed out all 12 Wes Anderson movies so I can watch them from start to finish. Wes Anderson's a director
that does the
and
kooky
writer.
Movies.
The kooky movies.
My favorite one is the one, the Royal Tenenbaums. That's my favorite one.
So, yeah, I figured those would be the right mindset for recovering while on pain medications and whatnot.
Listen to how pre-planned he is. This cracks me up.
And then I have some books on tape, and I'm going to do an AI course, as we talked
This
about.
is the one that'll help Project Next figure out AI.
Yeah. So like 30 days of learning about AI to do various things around editing and other things. And I figured if I don't actually learn anything or like retain anything, it's not the end of the world, but it'll be fun to learn something. Yeah.
See, you guys, you're getting behind the scenes of how this mind works. And it's really funny. And I will be talking about Tim while he's gone. It's hard for you to admit the good things you do for the community. I think in your mind, I think you're always like, I could be doing more.
Mm-hmm. I have this thing where if you achieve it, that means you achieved it. So you accomplished it. Great. So that means...
Then you're just immediately on the next thing.
Right, because if you've achieved it, why... It wasn't that hard, right? If you were able to do it.
I've been friends with you.
That's a messed up thing in my head.
Not
right?
Even...
But you put it in such a way that you don't have to achieve it.
That's what I was... Yeah, you don't... Dr. Tim Peck, you didn't have to do the good thing, but you chose to.
Right.
You're choosing to use your smart brain and your drive, even when you don't have the energy because you're low blood. You're still choosing to do this thing to help the community. And that's amazing.
And, in terms of low blood, I have to get blood transfusions sometimes when it gets really low. And my last blood transfusion was in end of September, October of this election cycle, right before the November election, and I didn't tell anybody, right? Just got that done, and I was so tired leading up to that, but it was the very end of the cycle.
That's when you finally let me know what was going on, which we were becoming closer friends then.
Yeah.
And I had no idea. And I just kind of was like, how is he doing this? Yeah. How has he been low blood, low energy, chronic illness, doing 10 times more than the average person? So it is interesting. Give yourself some credit, and also allow yourself to rest and heal. That is, I think, what your wife is most worried about.
I'm excited about it. I literally, for 2 weeks, I
was a little excited about the thyroid surgery. I was like, I'm going to rest. I'm going to sleep. So I get that feeling. I get it.
Yeah, like, oh, boy, that's going to be amazing. I'm going to be in pain, so it's not exactly restful, but...
Yeah, that was the reality for me. Mm-hmm. I was, like, super excited about the rest, and I don't remember it very much because I was still coming off from the anesthesia.
Right.
So it was just instantaneous wake up pain, nausea.
That's terrible. That's terrible.
But keep telling yourself you're looking forward to the rest.
But there is this new pain medication, right?
Oh, that's right. Are you going to try it?
Yeah, I got that.
This was on another Dr. Tim episode. We talked about this pain medicine.
What's it called? Non-opioid. It's Jurnavix. And I literally know no one that's taken it or prescribed it. And my doctor was like, yeah, sure, whatever. Yeah, like this will be fun.
So good experiment for a doctor to try the
new pain medication. We'll tell you how it works.
So when you come back, we're gonna have to do a follow-up. How did the surgery go? How was recovery? And tell us about this new pain medicine, because supposedly it's not as addicting as the opioids what we have at the opioid crisis, which is still going on and it's terrible.
Right.
So you can let us know, did it feel addicting?
So I'm still gonna be taking opioids, but a lesser dose of it because of this pain medication.
Interesting.
So we'll see if it works.
And I don't take opioids. If I get them prescribed, I just don't take them.
I don't either, but this is something.
You're probably going to have to.
This is different.
This is a new type of pain.
I did take opioids. I had a kidney stone on Christmas Day.
What? I didn't know that.
Last year. And literally, I was talking to my wife about how wonderful this is. I remember we had our son. It was the first Christmas that he really was going to remember everything.
Yeah, he's 2.5 now.
And like really engage with it, knew it was Christmas. And we were just talking about how great it is on Christmas morning. We had finished opening the presents, and all of a sudden I was like, I don't feel well. And the pain was so bad. And by the time, I don't know if you ever had a kidney stone, but man,
my dad has. It sounds terrible.
Man, does it hurt. And so, yes, I took opioids for that, for sure.
Okay, well, that makes sense. Interesting.
Yeah. Mm-hmm.
I want to do a quick shout out to our location. Mm-hmm. We're at Floyd County Brewing Company in New Albany, Indiana. Both of us were separately invited, and then when we were talking about our schedule, found out we were both going to speak, which was really funny.
That's right.
That's the first time I think that's ever happened.
Mm-hmm.
And so we met here. There was about 40 people that met that are people that want to unite, not divide. They want to be more locally involved, more involved in their local government, which is, it tracks. This is our brand.
Yeah.
So I got to talk about
Especially
Project Next.
the not divide part. How do we bring people together? It's such an important moment to find people, to kind of set party aside and find, commonalities. And one of the commonalities is we want our local community to be better, right? That rises above politics.
So that was really fun. So it was people we knew and people we didn't know. So I talked first, and then you talked, and then they just gave a bunch of great groups that help you get more involved locally. So it was a really beautiful event. And then I asked the people working here if we could film here, and they were very wonderful about it. There's this like private area you can rent out that's behind us where you can get food and just have the people at your meeting there. This is the second time I've done a meeting here.
Yep.
It's a nice location. So if you're in downtown New Albany, it also has outdoor seating. That's where we're at right now.
Yeah, it's beautiful. This is great.
It is a nice location. I like that.
There's a blow-up mushroom here. That is at least 2 stories tall.
There's the blow-up mushroom.
Not sure.
Sorry for podcast people, but it's a legit blue-stemmed red mushroom that is about 2 or 3 times our height, maybe.
Yeah, it's one of those things that's plugged in so that it can stay up. That's
I like it.
It's a thing.
I like it. Yeah. So yeah, it's a cool place. It's right by the Y in New Albany.
Yeah, which is where I swim and now haven't swum in a long time.
Beautiful Y. Can you see it? Isn't this fun? The on location shows. I don't know how much you've seen, but we're trying it out.
Our first on location show.
I did one yesterday testing it out with Brian Zimmerman. It was like 8 minutes long, and it was at his family's business. And because I was nervous about doing this one because we were on a time constraint.
Right.
And it worked out great because I did one thing wrong and I couldn't figure out what it was wrong, but the Special Forces veteran figured out in like 1 minute.
Right.
So.
Well, I wanted to talk about something unrelated in the health world right now, which is social determinants of health.
Yeah, I don't know what that means.
SDOH. And you will. It's one of these things where you don't now, but
it's about to pop up in the media.
Soon. Right.
Okay, social determinants of health.
Right.
Okay.
And so the Medicaid program, the Medicare program, it usually and traditionally pays for medical care. And what medical care has been seen as is, okay, I have a condition, I'm seeing a doctor, they're prescribing a medication, they're doing a surgery. That's medical care, and that's what we're paying for. That costs money.
Okay.
To do that, right? And we know that if we give people a lot of primary care, we see them up front, follow them, even when they're not that sick.
It's cheaper because you prevent
diseases.
And then you make their life better because they're not sick.
Right. So we want to invest in primary care because it saves money in the long run. Another example of doing medicine to save money, while it's very good for people, is palliative care at the end of life. Right? To do palliative care means keeping people comfortable, making a beautiful end of life. Their family could be around the bedside and addressing all these needs instead of, being in a sterile ICU where you have all these needles and things that eventually just aren't going to do much except for extend life a little bit in a painful way. Right? Versus having a more beautiful experience. Palliative care also addresses a lot of the social determinants of health. So I'm going to use this as an example.
Okay.
So that we can talk about social determinants. So what palliative care isn't just a doctor treating you, but there's nurses involved, social workers, clergy, people who come and do aromatherapy for you. That's one of the big things in palliative care is because you stop being able to enjoy food, you go outside.
So your pleasures are so small, you need some things to just bring joy to your life.
Right, and so you do all these things. All right,
so,
and then people, let's talk about social determinants of health. So you, right now, what makes you healthy? You always talk about access to exercise.
Yes.
So like having access to exercise makes you healthy.
Right.
And saves the healthcare system money.
Yes.
And so if Medicare, Medicaid or private insurance were to pay for encouraging you to exercise, it would benefit those insurance companies because they'll spend less.
We do this a little bit. So I have, my insurance has an app and it tracks, I have a Apple Watch and it tracks my steps. And I put on there when I work out. And so it gets workout. And then I go to the app and I add how many hours I sleep. And then I add my weight every day because with the thyroid stuff, I track my weight. and then and then my husband does it, and we sign up for like competitions for like steps and stuff.
Sure.
So we do those, and then we sometimes watch videos on Care. Like, here's a yoga video, or here's this, and we get points, and then at the end of the year we use the points, and we always spend it on Christmas presents.
Great.
So we do this a little bit.
So that is your insurance company addressing the social determinants of your health.
So they're trying to encourage us to be healthy. And then I know of friends and family that do this. They track their steps and get money. So it's a common thing if you have like a decent insurance, I guess.
Right. And so they're doing it. Why is the insurance doing it?
Because it saves them money. They're giving us money, but they're saving way more because we're not as sick.
That's why your private insurance is going to do that. And private insurance, they can pay for anything they want. There's no one telling them they can't pay for something or not. For Medicare and Medicaid, either states and the federal government really is saying what you can and can't pay for in many ways. All right, so can they pay to encourage you exercise or not? That's going to be up to Congress. But
I would say giving us money from the private insurance company works. We would do it anyway, honestly, because we really want to live a long and healthy life for our kids since we're older parents.
And so what you're talking about is easy to wrap our heads around because you're a healthy person, you're engaging, right? So now let's think of someone who is below the poverty level, tough access to other things, is working.
It's a lot harder to work out because they're working multiple jobs, so working out's harder. It's probably harder to get healthy food.
Get healthy food is a huge
probably
part.
a big problem.
What else is it hard to do? Get transportation to get to the doctor.
Yep. Even get enough sleep if they're working multiple jobs.
Right.
They're probably very stressed, tired, overworked.
Or even get off work to go to the hospital or to a primary care doctor.
Right.
There are so many things that dictate what it is, our access to health, that are beyond just paying for the point of health.
Right.
And so whose responsibility is it to do those things? Well, I believe most people in health take politicians away.
Right.
Most people in health believe that spectrum of things is the healthcare system's responsibility as a community member, as the healthcare system is part of the community. It's their responsibility to help engage the community in general. Because if you're sitting there waiting for your patient who doesn't show up because they couldn't get transportation because their car wasn't working, or they weren't able to get off their job to see you, or whatever reason it is or they didn't have childcare, or they didn't have one thing or another that couldn't get you. Now they haven't had the care. I didn't get paid as a doctor because no one came to do it. Because the only thing that's getting paid by me is seeing them and doing that thing. And the healthcare system's going to be so much more expensive because that person's going to get
in the long run, it would be cheaper to even help that person come to the appointment.
That's right. So what I want to say is you're talking about your private insurance does some of this thing, but Medicaid does this a lot.
Right.
And they have a lot of ways to get that done. Medicare also does it through Medicare Advantage, which is when private insurance companies...
My parents have something like that.
Yeah. And private insurance companies manage the Medicare benefit. They also do it. The VA also does a lot of it. VA does a lot of this.
My parents can go to the Y for free. And they can go to other workout places for free with this program that you're talking about. So those sound like really good things.
So if you are a fiscal conservative, you believe in
saving money, lowering taxes,
yeah. Pay for social determinants of health.
It will, in the long run, save so much money.
Even in the short run.
Yes.
Someone who's having a problem, who puts it off for a day,
that's going to be so expensive when
now has to go to the emergency department because they're much more sick, and now they're having a heart attack versus
so in the short run it's cheaper. You're so right. Yeah.
In the short run.
Yeah.
So the fiscal conservative thing is to pay for social determinants of health. But the term, which is great within medicine, is now being seen in politics as a bad thing because the social determinants of health. It sounds
social. They like to throw out the social word as scary.
As a scary word.
But I don't like
our word in healthcare that wasn't meant for politics in any way. And so when we're talking about the budget right now, which we're coming up upon needing to pass a budget.
The national budget.
The national federal budget is expiring in less than a week here.
Do they have to come up with a pass or can they do a thing and
continuing
continue
resolution
it for a few more months?
Right.
Like they keep doing that, right?
Yep, and the Republicans have proposed the continuing resolution right now. The problem with it is that a lot of the cuts and the freezing on spending that will happen means that you'll have to cut Medicaid dollars.
Oh, so they're wanting to cut these type of programs.
Right. So if you're
help.
going to want to cut money out of the budget, you're going to have to cut Medicaid dollars. And don't believe me, believe the Congressional Budget Office, which is the CBO, the budget office that goes and says, okay, here someone proposed a bill. I'm going to score it. I'm going to say how much it's going to cost or how much it's going to save. And they do that for every bill. They're saying there is zero way that current proposals will not, zero way that it won't cut Medicaid. You have to cut Medicaid or it's not going to happen. Or Medicare, but they'll probably not touch Medicare.
That's going to actually end up hurting my parents then.
Right. And so where is that happening?
You guys might ask your people if they get some sort of benefit. Yeah.
And where they're saying, where we should cut? Social determinants of health. Healthcare shouldn't be paying for our transportation. Healthcare shouldn't be paying for our access to exercise. Healthcare shouldn't be paying for more nutritious food.
Not only does it save money, it's the right thing to do.
And this is not me just saying save money. We've been doing this in healthcare for decades.
Right.
And it shows the more you do it, the more money you save.
All the research says it helps people and it saves money.
That's right.
It seems like a no-brainer.
And so research, and it's not just academic research. Forget academic research. Private businesses do this.
Yeah.
There's a whole startup community that does this.
Yeah, they make it really nice to work at your location. Like Google would have really good food or like a place, a daycare for your kids.
Right.
I have a friend that works at Google and he gets a ride. They come and pick him up so he can work on his computer in his cushy, nice bus.
Because it creates more productivity. The same thing happens with healthcare. It creates better health outcomes.
And it's not like Google's doing it to be kind. They're doing it.
And
they're doing it because it gets better work. Think about our society. Wouldn't we benefit as a society if more people are healthy and happy than if they are recovering from major surgery that they can't pay for?
And we know that when
they could have prevented.
We know that when people are lonely or isolated, their health outcomes are much worse. They suffer from dementia quicker at higher rates, which is such an expensive disease. It's devastating to families.
Oh, so sad.
And it brings kids of older people away from the workforce. It is the most fiscally conservative thing you can do is invest in social determinants.
Yes.
But once you use that word invest, it's often seen as not fiscally conservative. But that's
I don't like it when we use fear words and we say fake things and we make it very simple. This is bad. Be scared of it. Stop it.
Right.
And it takes just a couple minutes to explain. But a lot of people don't have a couple minutes. Mm-hmm. So if you are hearing this, because he's a little bit ahead of us, it's going to pop up soon in the news, you guys can now do a good job of explaining what that means. We want to take care of people so that they don't get as sick, so that they don't need surgery that could have been prevented. It saves money and it makes the whole community better.
Yep.
Also, it's morally the right thing to do, which is the big thing.
And let me tell you, it cuts across into venture capital world likes this stuff. Wall Street likes this stuff. People on Medicaid like this stuff. The social workers and the people who are serving populations who are disabled, who are elderly, who are poor like this stuff. The populations who are getting like this stuff. The insurance companies like this stuff.
Saves insurance companies money.
It cuts across all industries. It does not matter about politics in any way.
So what do we do? Is there anything we can do?
Well, it's being politicized already. You're going to hear the talking points in the news of people saying, I'm not paying for your car ride to the doctor's office. What? Am my tax money going to pay for that? Right? And they're going to weaponize it for us. Same thing you'll hear, aren't people bad who are trying to cut, my mom's access to vegetables? Like, you're going to hear it on both sides of people trying to weaponize this issue.
But it's a beautiful thing.
A weapon.
And it shouldn't be used politically. We should just be trying to help the community. We should just be trying to help.
Anyone who's using it as a weapon is completely just doesn't know what they're doing. They're just trying to make political points.
I
This
just
is a
want to point
program
out we
that
do
we
this
need.
in our county. So we have Blue River Services in Harrison County, and I don't know enough about it. I'd like to have somebody on to talk about it, but I do know that they offer rides to people. They offer rides for seniors, like $4. They'll take you to the eye doctor. So I have a friend that works there, and I saw him at the ENT where I'm going to take my kid later today. I saw him there taking someone there for $4. And I'm like, I love that. That person wouldn't be able to get a ride in rural Harrison County to New Albany to go to the doctor.
So, I owned this business where we treated patients in nursing homes through telemedicine. And we struck a deal with Lyft, Lyft Uber with Lyft.
Right.
To pick up family members to bring them to the nursing home or to the hospital if we had to transfer that person. And it sounds just nice, right? But we know that when a family member goes with their patient, their mother or father or whomever it is, to the emergency department, they are 6 times more likely to come back to the nursing home than be admitted to the hospital.
Wow.
Because now you have someone there who's advocating for them.
So not only the right thing to do, saves a lot of
ton of money. And an average hospitalization for someone of that age group from a nursing home costs about $20,000.
And side note, Tim lived in a nursing home for 3 months?
3 months. Yep.
3 months to better help, and he helped start a telemedicine to better help people in nursing homes. So if you're going to tell a story about a nursing home thing, trust he knows more than I would say most people, except for people that work there every day.
And if you want to talk it from a strictly business standpoint, doing that, bringing family members to the bedside, was one of the best business decisions we could possibly make. And so if you're a fiscal conservative, you're saying, well, you got to cut these crazy programs. What are we paying for this? That person's not even sick that we're paying for a car ride for, or whatever it might be. And there's all these different things. And the private insurance companies and private physician groups and other things have been given this freedom to use the money to figure out these things to bring costs down. If we cut that stuff out of our budget, it is going to balloon.
I just want to deep dive into this a little bit in the mental fitness aspect of it, the mental health aspect. When people say, you shouldn't get that service, we shouldn't be paying for somebody I don't know to go to the doctor, I feel like it comes from a place of hurt. Mm-hmm. I feel like it comes from a very private place where they don't feel like either they got that care, nobody's taking them to the doctor, and nobody would. And they don't feel loved, and maybe they don't feel worthy of a government paying for them to go to the doctor.
Right.
And it's a deep problem that we need to spend more time, in my opinion, talking about. If you are hearing a loved one make that argument, which is their biggest argument, I'm not paying for somebody else to do this thing that helps them, realize it's coming probably from a place of hurt, and they themselves don't feel worthy of it. And instead of getting mad at the person saying it, give them love and empathy and care. Yep. Let them know that, you could say, this person, if you got sick and couldn't go to the doctor, I would want my taxpayer money to go to take you to the doctor. I would be happy with that. And then that makes it more personal for them. And then if they don't think they deserve it, let them know they deserve that. I think every human being deserves basic rights and freedoms and care. And when we live in the richest country in the world and can easily do this service, we should.
Yep.
But
so that's the human aspect of it. And then there's also this financial aspect of it. And when you can find these issues that save money and help people, these are the things that are just perfect for bipartisan work.
Yes, bipartisan, because they all, the right is always saying they want to save money. This saves money and help people. I've heard you talk about this before when you've gotten things passed. You've been to Congress. You've worked to get things passed. When you talked to the left, you say this helps people and saves money. When you talk to the right, you say this saves money and helps people.
That's right.
Same exact issues. You're just putting one in front of the other.
And this is one of those things.
I think that we should have bipartisan. I like that we do that at Project Next, because we're not afraid to admit when either party does something right or wrong. Mm-hmm. And I wish we could just stop politicizing everything.
Yeah.
I wish our news sources didn't plug
And so
everything as good or bad, and then they don't just tell us the truth.
What I want to tell you is before you start hearing this term, those who are watching,
health determinants,
social determinants of health.
Trying to learn it.
SDOH. Before you start hearing this term, which you will start to hear in the news, be ready for your leaders and the media that's helping them to tell you all these talking points, and do not repeat them. Think about it for yourself of what's going on and say, okay, there's a fiscal aspect of this, there's a humanitarian aspect of this. How can I actually understand what this is? Because if you're on the left, you are about to be fed from MSNBC and other places about how bad the other side is for cutting things. And if you are on the right, you're going to be hearing from Fox and other pieces of conservative media that the left, they just want to spend all your money. And that's not what's happening.
Never forget, they're profiting off of our fear. They're profiting off of our division. They want us to not like each other.
That's right.
We just did a meeting today where we met new people and we helped unite, and it was a beautiful thing. And those people felt better being in a room together, talking about helping the community. That's what we need to be doing. We don't need to be panicking, fearing, and just realize the news sources are doing that to us. And that's why we started Project Next Media.
Right.
I want to talk. Is there any big things you want to talk about? Because I want to talk for about 5 minutes about exciting shows that you don't know about that are coming up.
No, yeah, I'd like to. And, we should, because our next show, which can't happen because I have this surgery coming up, we would do an update on measles. We would do an update on bird flu. So there's so much to talk about that, but measles is still spreading.
I'm really proud of you. Her last Dr. Tim was all about measles, and I learned it so well. Do you know I've told like 6 people that information that you told us on the show to help them understand. So you did a good job. If I can say it,
you can understand what it is.
Yeah.
No, you're great. So, this is. There's so much to talk about there, but it's still spreading. It's something that we have to take care of and be attentive to.
Because we need 95% of the population to be vaccinated for measles so that there's not an outbreak. And in Indiana, I think you said 92.7.
Yeah, we're about 93.
93%. And then in Texas, where it's bad, in that one town, it's 80%.
One area,
It's 80%. So that's why it's worse there. So you see, you summed it up for me.
And
I didn't even know what any of that meant.
Samoa, it went down to 30%.
That's scary. Yeah.
And there was an outbreak where 100 kids died.
Ugh.
And so...
it's so upsetting when it's so preventable.
It is a preventable disease. Get your vaccination. And one of the things that people ask all the time about that is, should I get revaccinated when I'm older? The bottom line of that is if you were vaccinated for this after 1970, you do not need to be revaccinated. If you were vaccinated before 1970, you should go talk to your doctor.
So my parents need to get checked. I was born in 1980. You were 81. We're good.
And like the real danger zone is if you were about, I believe the year was 63 to 69.
63 to 60, because that's when it first came out.
And it wasn't strong enough at that time.
It was the dead virus, and it wasn't strong enough. And so now it's not protecting us anymore.
Exactly. So after 1970, it was a better...
But you can get a simple blood test, right, to check if you have immunities from the measles.
That's right.
If you don't want to just get a vaccine for it.
That's right. And so go talk to your doctor about that, and they'll help you.
And also, you've never seen somebody with measles, and most doctors haven't. That was fascinating.
Never. I mean, why would I see something? I mean, it's not a disease that we're used to seeing or that's really prevalent, but it was. Lots of people died, and we gave all the numbers on that in Dr. Tim.
I know what I want to say. Those of you watching that personally know Dr. Tim Peck, including myself, this is for me too. We got to ease off the texting and messages and calling him. I'm gonna message Missy, and then find out how you're doing. I'm gonna try so hard. I've got this Project Next question. I'm going to try so hard to not bug you about it. And I'm trying to find out from everybody else before I come to you.
Yeah. You're going to get a nonsense answer if you try. So
I will at least wait a good amount of time. But if you know him personally and you send him stuff, just know he's going to have major surgery tomorrow. And he's got a busy list of recovery things he needs to do, apparently, right? Your baseball and your thing. So, So I am personally, really excited to get the stitching up. I'm imagining somebody stitching up your hole that's leaking blood. That's how I imagine it in my head. I'm sure that's exactly what it's going to be.
That's exactly what's happening.
I'm exactly right. Needle thread, they're fixing it.
That's right.
And then
someone's just sitting there.
I just can't wait till the recovery, and you're like, you have the good color, the skin color, because you got enough of your blood. I can't wait for that. I'm so excited. So, and then I met Brian Zimmerman, and we're gonna do a mental fitness show tomorrow, where we are gonna organize his incredible life. And
I met Brian. I spoke to Brian today. Guy's incredible.
Yeah.
Absolutely. Just an amazing story. We related actually on, my father was a Vietnam veteran, combat veteran. He's a veteran. And they both have had to go through a lot to recover from the trauma of that. And both have given a lot back to the community, and Brian's going to give even more. That's what he sees this as, a way to give back to the community.
And he'll talk about anything, because I have been asking him really personal questions, and he just gives me like a great answer. Yeah. So I know I'm going to learn a lot from him.
Let me say something. When I spoke to him, it's one of his first questions, like, how are you feeling about tomorrow? And I said, honestly, I'm a bit scared. And it was a very vulnerable thing from like one man to
that is
say
so
to
nice.
another.
That makes me so happy.
But he's so open and able to have those conversations. You're safe not to
get told him stuff I don't tell most people when we talk for 3 hours. Yeah. And he told me, and I'm like, oh yeah, we know each other pretty well now. Yeah.
And like if I were to say that in such a way, like I had to say it in a more professional, I'd be like, yes, I am frightened about that. Like I just said it to him.
But you just said it so open and honest. Good job.
I'm very excited for him to be on the show.
So that's tomorrow at noon, and then we're going to come out on most Mondays, unless one of us is busy. That's our plan, because he works.
Really special guy, veteran, going to be talking about mental fitness, and especially as it relates to veterans and
I think he
men,
can.
In general, as well, and people who've had trauma, and people who have been part of trauma, like
panic attacks. He's going to have good tips for panic attacks.
Yeah.
He just found out. Side note: he just found out he was having panic attacks silently, as you couldn't tell, because when he's on missions and stuff, he can't be loud. He could die. So he learned how to silently have a panic attack. So this guy can also help us deal with panic attacks.
Yeah. Wow, that's amazing.
Isn't that amazing?
I think. Last night you sent me a picture of him jumping out of a plane.
Yeah, that's the picture I used to promote the episode. Isn't that cool?
It was very cool. I mean, this guy's badass. Really,
I'm like, am I bothering my husband with showing him multiple pictures of Brian doing cool things? Nope. He's like, that dude's amazing. Show me another picture. That's pretty much how everybody is.
Through this process, the people that I've met, but also got to know better, of doing this show and having the mental fitness show, including Destiny Wells and Brian, what they have in common are these two veterans, these two people who have been given so much for us, to our country, who are so strong, who have had trauma, and talk about that trauma openly.
Yeah.
They are the strongest people I know.
I know, me too.
Because of
and I'm really drawn to them, because I want to know all their tips. And just being friends with him for 9 days now, he's given me tips on my hard things. I'm like, so I'm going to do this hard thing. And he's like, thinks about it. And then he says one sentence, and I'm like, I should do that. And then it helps me. So I can't wait for him to help all of you all that watch. So, and then there's another.
Let me say to these people, so Nancy, thank you so much for the positive thoughts. And then Jeff, thanks for, sending me the luck for the recovery.
Joy said, I love that idea, getting all sides together to try and understand. Best of luck with your recovery. Thank you both for the information. Thank you for saying that. That's so nice.
It is wonderful. It's good to have the well wishes. It really is. Because usually I'm very private about these things.
He is so private. And I realize sometimes I tell my closest friends about you because I want them to care about Tim. He needs it. He doesn't say he needs it, but it helps because he's out here fighting for us every single day. And just on me personally, when I was in a dark place almost a year ago, people caring about me really helped. Even if it was people I hadn't seen in years, just the fact that they said something nice. So it does matter to your mental health. You're human just like all of us, even though sometimes you seem a little above human. Honestly, definitely to me, when I don't even know how busy you are. I just see a little bit of it, and I'm like, how's he doing all this? It helps. So yes, keep sending the positive thoughts.
I had an overnight shift last night in the emergency department.
Oh yeah, do you want to talk about that? You just started going back to work after a few years.
I did, but I did get to after the shift go and lie in my son's bed and sleep with him, and he woke up in a couple hours later, and was able and like jumped up and was so scared to see me in his bed, and then like calmed down, and then he like snuggled up against me, and we went back to sleep together,
Aww.
which was very cute. But we didn't get much sleep in total, so I'm a little bit tired right now because we're converting back.
But hey, you're gonna have surgery. You're gonna get knocked out.
But that's the thing. That's what I talked about with my wife. I was like, I'm gonna keep moving and get everything I possibly can get done before this.
Done so much.
Last night we had a big meeting as well that I had with about 15 people who are on the team for running for Congress and getting organized and just trying to hand things off. It's been good. But yeah, working. I'm back in the emergency department. I'm not going to talk about who my employer is as things. I don't think that's right to do on this. So just
but
saying
you're
that out
enjoying
loud.
it. You told me I could tell you were happy on the phone when you were telling me about it because you get to genuinely help people quickly and care about them.
Amazing. It's been amazing, and I took a particular job where I have a little bit more time with patients than I would otherwise.
That's nice.
So I get to sit down, cross my legs, talk to them about the things that are the social determinants of health, their mental,
that actually matter, that help make their life better.
Let them cry a little bit if they have to. Let them tell you about
If they need to tell you how hard their life is, you sit and listen to it. That's nice.
And you sit down and you cross your legs and you do that for 3 minutes. It feels like a half an hour to people because they're not used to it.
You're a very good listener. That is a very nice quality.
So, that's been an amazing, and just getting back in the game and treating people. And
I'm happy for you. Of course, now you're going to take a big break from it, but you're going to get started. Once you get healthy again, you'll go back to it.
Yeah, I'm going to work again in the.
We'll be able to tell when he works because he won't be as active with Project Next, but then he'll come back when he's So I'm excited for you.
Yeah, it's good to be in the community again, and I'm looking at other jobs in different parts of the district, one in Bloomington.
And I think you'll learn a lot about the community and helping people, and then apply it, and we can talk about it on the show. You'll meet all kinds of different people in the emergency room.
Got to be safe around not giving away identity or talking about people's specific problems.
I like that you told me Cass didn't know he thought you were playing doctor. Tell him that one. That's funny.
Yeah, he never knew I was really a doctor, and every time he saw me in scrubs, he thought I was dressing up like a doctor.
Because he's just 2.5, so you took a little break for a while he was like born and running while you're running for Congress. So that's so funny. He's like, "Why are you playing a doctor, Daddy?"
Yeah, and now he is old enough to understand it. It's pretty funny.
That is funny.
It's great. It's cute.
And then we're having a Karen show, Plots and Politics, Friday, I think at 11:30. I just talked to her today. She is super busy, by the way. She's working it. She's starting to get hired with individual little things to do communications jobs because people are figuring out how good she is at that. Yep. So I'm really proud of her.
Obviously good.
She was on the way to a job when I talked to her.
Nice.
So I'm excited for her.
Good.
And then I'm going to do a get the word out about my friend named Kurt Mullins. He has 90,000 followers on Instagram, and he lives in Wabash County. And he tried to run for chair of Wabash County. And the same thing that happened to Corinne happened to him, but it was even worse. Not only did they deny him a chance to run for chair or vice chair, but they also told him he is not allowed to come to Democrat meetings for a year.
What?
And he's a freaking amazing person. And he has 90,000 followers on Instagram, and he's a really good communicator. And he was already making plans to fill up the ballot in the county. And now those people are not going to do it because he's not the chair. So we're going to deep dive into that. I think I'm going to get Corinne on that episode too and talk about gate. I keep having to come back to gatekeeping. Yeah, you and I didn't have it happen. We're lucky. But other places in Indiana, their Democratic parties are loving that. They love the rules. And then I'm going to keep your secret. I want Kurt to tell you the reason they kicked him off because it is mind-blowing. Like I cannot.
I'm not going to be able to watch, so you have to tell me after this.
I'll tell you after it. I just called him today and got the story from him. So he's going to be on soon. I'm also going to be on his Instagram. It's Kurt Mullins, Kurt Bullitt on Instagram. You might already be following him. A lot of people are. But I'm going to do a live with him hopefully next week on his channel.
Cool.
So we got some fun stuff coming up.
One thing, as well as Brian Zimmerman, to note, is a conservative. He's a Republican. So
did you ask him that for sure? I know he leans to the right.
He didn't say he was a Republican.
He leans to the right, and he.
So we're just been actually seeking out more people with rightward views.
Yes. So we're more balanced.
My nephew's gonna do something in a little show, and might become a big show. He's got a huge personality, and he's.
I met him in person once, way before we did Project Next, so I'm glad I met him in person.
Yeah, so he's a Republican who's just works across the aisle in a lot of ways.
So we are going to be working to get Republicans on that also have these same goals as us to work together for the community, so we can unite, not divide. Yeah,
that's the commonality.
Oh, we
Unite,
gotta
not
go.
divide.
We have to go. I gotta go take my kid to the ENT.
Yep.
Care about my friend Tim. I am going to be a little bit nervous tomorrow. The surgery is supposed to be around 1, isn't it?
No, it's like 7:30
at night, in the morning.
in the morning.
Oh, okay. For some reason, I was thinking it was later.
5:30.
So it's in the morning. That's good. You don't have to wait so long to be hungry.
Yeah.
Okay, so surgery's in the morning. I will talk to Missy way later in the day and just make sure he's okay. And then the next show that I do live, I will update everybody on how you're doing. And then just know we're here for you. I'm here for you as a friend first, especially when you go through difficult surgery. I cannot wait for you to keep your blood. I cannot wait for you to keep your blood. I'm so excited.
I really want to keep my blood. Yeah.
So thank you all, and please share. And we're almost at 1,000 followers on Project Next Facebook.
You know what I'm really excited for?
What?
To give blood.
Oh wow, you probably haven't been able to do that for a while.
Over a decade.
Yeah, because you can't afford to lose it.
But yeah.
Wouldn't that be nice? You have extra to spare.
When that happens, it'll be a celebration, right? That will not only mean I'm gotten better, but I'm thriving.
Maybe we could do an on-location show
of giving blood.
Blood. What a big moment.
Cool. That'd be pretty cool.
Yeah. Okay. So you guys take care, and I'll see you all tomorrow at noon with Brian Zimmerman.
I need to say thank you to my doctors, my nurses, everybody who has and will be taking care of me. You know, the people who go to work every day to take care of us. Just incredibly grateful for the whole team. There's so many people that are involved in it. The phlebotomists who draw blood, the administrators who, do the books, the people who are at the front desk, all the volunteers that are in there, the people who clean the rooms. There's so many people involved in healthcare.
Seriously.
And often we just thank our doctor.
Thank everybody. Thank everybody that's helping my friend Tim deal with this major thing and help him get better. Yeah, thank you.
Thanks,
okay.
Everybody.
Bye, you guys, and
Bye.
we'll miss you on the show, but we'll see you as
weeks.
soon as you feel better.
Yep.